Hi everyone, welcome to this session. The session is entitled, well, you all know better than I have to open up my app for it. The Path Process, a participatory workshop on housing prioritization. I'd like to introduce the speakers for today and my illustrious colleagues in the work with the NIHC, National Indigenous Homelessness Council. We have Irene Ghana, who has been leading this work, this process, this community-based project for the last 4 years. Is it, Irene? 4 years? 2021, 5 years almost. Irene is our National Indigenous Homelessness Systems Pathfinder and project lead on the Path Process project, working remotely on unceded Algonquin territory since 2021. She's advanced Indigenous-led approaches to homelessness, drawing on her background in social work research and curriculum development, including her role as a faculty member of the First Nations Technical Institute. And Jolyn Paronto from Medicine Hat, Alberta, is known as one who provides aid. And I'm sorry, you'll do it, okay. Known in community as one who provides aid is the National Indigenous Homelessness Community Pathfinder. Her professional experience includes building Medicine Hat's Alberta's Indigenous Coordinated Access System and roles in advocacy, navigation, community facilitation. As a proud Métis woman, author, and Indigenous personal finance educator, Jolyn uplifts housing voices and solutions coast to coast. And I just want to say a personal word that when we started this work back in around 2018 with the federal government, at the time it was HPS and now it's Reaching Home. And they approached us for some funding and or with some funding and if our community had any ideas on what to do. And one of the first things our community decided was we needed a standard national in scope way of working on prioritization and assessment. We felt as though the current approaches were not meeting the threshold of the Indigenous community and the Indigenous service providers we represented or aim to represent. And so we brought on Irene and we very quickly scooped Jolyn from our board of directors. And they have just taken this project and just ran with it. And it's been so beautifully accepted and welcomed in community. I can't wait for you all to experience it today in this workshop or whatever we want to call it. But without further ado, I'll turn it over to my wonderful colleagues.
Merci, Shane. That's wonderful. So, bienvenue et bon après-midi, amis et collègues, et en la langue Michif, Munikesh Katuk, puis bon après-midi. Tout le monde, welcome and good afternoon, everyone. Merci, Marcy, thank you for joining us from coast to coast to coast to Jojage on the traditional unceded territory of the Gonyaga-Haga peoples. We thank and honor the past and present Wakamakanak, the ancestors and guardians of the lands, winds, waterways, and skies, whose footsteps have marked these paths for generations. Bonjour, Tanchikiawa. Hello, everyone. Onisokamaku Jolyn Paronto de Shinikashon. Minodi famille si Paronto, Belanger, Thibault. My name is Jolyn Paronto. Je m'appelle Jolyn Paronto. I'm a knowledge keeper, storyteller, and Onisokamaku in Cree, one who provides aid, like Shane said. My family names are Paronto, Belanger, Thibault. Kishchite Meyoyan and Litant Winchifuyan, Ma Paranti à Rivière de la Paix, Pi Paddle Prairie, Oshiwak Pidoshin, Dontedi Trial CAEH Oshiwit. I'm a proud Métis auntie. Myself and my relations, respectively, are from Peace River and Paddle Prairie Métis settlement in northern Alberta on traditional Treaty 8 territory. La Machine di Chapud ni Wikin Dontedi Trial CAEH Oshiset Picat. I'm visiting from my home in Medicine Hat, like Shane mentioned, in southeast Alberta on Treaty 7 and 4 traditional territory, and Otipemisiwak Métis Nation of Alberta District 2. I hold a personal and professional call to action for housing insecurity with the lived experience and in establishing Medicine Hat's IH3, like Shane mentioned, with advocacy and education roles from the local to national level. D'Atouchkan pour CNAI, nous travaillons pour le Conseil national autochtone sur l'itinérance. We work for the National Indigenous Homelessness Council, dedicated to culturally relevant solutions to address Indigenous homelessness. And so we're here to share our work thus far on the Path Process Homeless project, developed with hundreds of Indigenous voices nationally. Since our project launched in 2021, the Government of Canada's Reaching Home program has supported Path's development and growth coast to coast to coast. So building a trailblazing process like Path takes time, and our Reaching Home and funding partners at HECC have met Path with support and resources every step of the way. My role is the National Indigenous Homelessness Community Pathfinder, and so I'm very pleased to introduce Irene Gano, who's visiting from Algonquin Territory in Ottawa. She's our National Indigenous Homelessness Systems Pathfinder and project lead for the Path process. Shane mentioned Irene has been working on the Path process since May 2021, the project's initial launch, and I'm so pleased to invite her to the stage. She brings a lot of knowledge, including her role as faculty at the First Nations Technical Institute. Irene is dedicated to supporting Indigenous community entities, community advisory boards, and communities in sharing their collective knowledge to develop culturally relevant solutions to address homelessness nationally and locally. Before I invite Irene to take the mic, a quick housekeeping for this session. Please relax, take in the first part of the presentation before we get to our interactive portion, and then we'll guide everyone in participating how to put on your story props. I see some of you have been very keen to do that early, and so we'll call you to the floor by your code word. So bienvenue, miyuna kishkatuk, please welcome Irene. Yeah.
So Path's been around for a while. It started in 2021, and it started with Indigenous people from coast to coast to coast, leading the development of something that was different for coordinated access systems specifically. It was known that the assessment tools within these systems weren't working specifically for Indigenous people, but for everyone. They were re-traumatizing. It was the concept of assessment in the homelessness sector just wasn't working well. And so Indigenous people from coast to coast to coast decided to create something from the ground up, something that was different and that would be culturally informed, something that was by Indigenous, but for everyone. So when we set out on this journey, we knew what we wanted to create. We knew we wanted it to be culturally informed, a replacement to those common assessment tools in the coordinated access system. We knew it needed to have a relational approach. That was key in all the narratives that I encountered on this journey. We knew that it had to be trauma informed, that it had to lean away from those deficits and into strengths, which we weren't seeing in the field at all. We knew that it had to facilitate community-based holistic supports and housing matching, but it also had to have that difficult element of prioritization and a decision-making component, which was something that no one wanted to talk about, but everyone agreed that Path needed to have that component within it. And lastly, if we were going to create something that involved prioritization, it needed to be open and transparent. It couldn't be what exists often in communities now is that prioritization happens, but nobody really knows how someone gets that housing opportunity. And most importantly, that means that they can't explain it to the people that they're helping. And so it goes right from frontline workers in Path. We train on this activity that you're going to experience today so that when they're in the field delivering Path, they can also say, this is why somebody got this housing opportunity over you, or this is how we prioritize in our community. And so when staff walk away who are delivering Path, they clearly understand how prioritization works in their community, which is one of the goals of Path. Back in the beginning of the project, people asked, well, what is Path and what is Path not? Like, how is it unique in the system? And so I've already talked on some of them. It's community growing, it's culturally informed, it uses that relational approach. That is one of the key pieces that differentiates Path than what exists. And what I mean by that is that it prioritizes the relationship between the staff and the person experiencing homelessness, centering their story, including their housing vision, strengths, and goals. It prioritizes that relationship between the helper and the person experiencing homelessness above all else. So it really starts with a conversational narrative approach versus a clinical or power difference approach. It also is process orientated. So it's not a one-time tool. It's meant to be something that's added to and grows as somebody wants to share their story of homelessness with whoever that worker is. It's also systems focused. So it moves away from what's wrong with the person and it moves towards what's wrong with the system. And so much of the homelessness sector is based on what's wrong with the person. It's that vulnerability and that shame view. PATH flips that on its head and says, instead of assessing the person, let's assess the system. And so the silver lining, which I'm going to talk about in a bit of PATH, is that data piece that comes back and loops to hopefully change the system. PATH uses a two-eyed seeing approach. And so that visit of when the person who's the worker is sitting with the person who's experiencing homelessness in that moment, they're using a two-eyed seeing approach. And so they're having a conversation with that person. So there's no clipboard with check boxes where it's question and answer firing. It's a conversational, narrative, person-centered experience. When somebody comes in, it's that relational piece. And so we train staff to deliver PATH narratively and conversationally instead of that question and answer kind of clinical approach. But it's two-eyed seeing, right? So there's the Indigenous way of being, which is that conversational, that narrative piece, but also that staff is trained to know what the content of PATH is and to be able to weave that into the conversation as appropriate. And when they go back to their desk afterwards, that's when they put that information into the database, whatever it is. It could be an HMIS database, it could be HIFIS. So they put that information into the database. And where that silver lining comes is that that information is not just on the person. It's not just on the person and what's wrong with them. It's on what's wrong with the system. So a huge part of PATH is what are the barriers and obstacles that are in that person's way of accessing and retaining housing. It's those systemic barriers and obstacles. And so that information that we're putting in the database can then be pulled out by communities using such as a software called Power BI in a meaningful way. So they can access that information, they can pull it out, and they can see in their community what are those prominent barriers and obstacles. So that when they're sitting around funding tables and they're asking for funding for something, they can speak the language of the funder, which is data. And so it is a two-eyed seeing approach, but it all hinges on the relational piece at the very beginning. It hinges on that moment when the staff sits down with somebody and they prioritize that relationship above all else, because that person isn't going to walk away with a house in that moment, but they are going to walk away with a feeling of what that encounter felt like. And it's really important that we're leading in relationship at the forefront of when we're working with somebody. Some of the quotes from our pilot communities is, we're excited to switch to PATH to talk with, not at people. Having patience is so important. People want to share their stories. We have 4 pilot communities across Canada that we're currently piloting PATH in. We have Whitehorse in the north, Halifax in the east, Winnipeg, we call it Central, but our east location, and also Vancouver in the west. Some of our communities, it says, PATH sees how coordinated access differs in Kabukchuk. We didn't have to re-engineer ourselves to fit PATH into our current practices and systems. We're gearing up to launch in Winnipeg and Whitehorse, and we've already launched PATH. It is in use in Vancouver and Halifax. We also have 2 preparation sites, Cowichan and Thunder Bay. Cowichan has said PATH felt like a natural and empowering process to integrate into our coordinated access system, PATH, and then they've also said PATH is really in line with our community values and the collaborative guiding framework of our Indigenous Advisory Committees, elders, and leadership. We hope these PEP sites can turn into pilot sites as well in the future, funding dependent. Today, I'm not going to talk to you about all of the content of PATH. We don't have time for that. What you're here to experience is the prioritization component of PATH, meaning the content of PATH can be viewed in 2 parts. Part of the content of PATH relates to prioritization, and part of it is beyond that. And so today, just keep in mind that we're only going to focus on the prioritization pieces of PATH. So you're not going to get that whole view. You all have a QR code on your seat that you can learn more about PATH. There's one on the presentation right now, but this is only going to focus on the prioritization component of PATH. So everybody in our inner circle came to our booth earlier, and they got props. They got props that represent a story of homelessness that they're going to tell in this interactive exercise today. And so I'm going to explain what all the props are and how it relates to each person's story of homelessness. Now I want you to keep in mind that these stories of homelessness on the floor today, some are fictitious, some are a story that a person has witnessed or a mishmash of stories they've witnessed, but some are people's stories. And so I just want to be sensitive to that. This is a fun exercise, and I hope there is some laughing and humor, but when we do go through this exercise, we are going to have a mock housing opportunity, and only one of the people you see on the floor today are going to be awarded that housing opportunity. And some of the people playing on the floor are telling their personal stories. So just be prepared for that in our workshop. So the first thing I'm going to do is all of the participants on the floor, if you could pull out your sashes. So each of you have a gold sash in your bag, and you're just going to wear it across your body. And on this sash, you're going to notice as you all the observers look around the room, that each person is wearing their household members on their sash. And so they could have a red badge, which is an adult. There's black badges, which represent seniors. They could have children in their household, which is represented by a yellow badge, or they could have a pregnancy in their household, which is represented by a white badge. Now, if children, youth, or pregnancy are involved in the household and there's a black ring around that, that means that those children, youth, or the pregnancy is at risk of involvement or has involvement with child and family services. Now, the reason this is included is because there's such high rates of Indigenous children who are scooped up by the system, removed, or involved with child and family services. And so part of prioritization puts them first. You can see Jolynn is wearing a sash with all of the types of household members. You might also notice that on the sash there is a rainbow pin. I'm not sure if I put one on there for you, Jolynn. This rainbow pin means that at least one person in that household identifies with the two-spirited LGBTQIA+ community. Next, you're going to pull out anyone that has a red rose. If you have a red rose in your bag, pull it on out and hold it in your hand. So the people with red roses, this represents that those households have an urgent safety concern. So there's someone in their household whose life is at risk within the next 24 hours. And the reason this is included in PATH is because what we found in the narratives early on in the project is that staff said, I'm trying to manipulate the numbers of the VI SPDAT, the VAT, to try to prioritize this person higher because I'm sitting on the ground with them and I know they're not going to make it through the night. And so instead of having staff feel helpless and have no power, they can flag a household with having an urgent safety concern. So if they're sitting with somebody and they say, this household has an urgent safety concern, there's violence, there's physical health, mental health, there's something going on in this household where someone's not going to make it through 24 hours, then they hold a rose. And so anyone on the floor today that you see holding a rose has an urgent safety concern in their household. Next, you're going to see anyone that has a yellow tulip. If you could pull it out of your bag and also hold it in your hand. So the yellow tulips represent the children that are not currently in the home, but they've been removed by the system. So the system has removed them from the home, and those households hope to be reunited with those children. So we didn't want them not to be represented on the sash, and so we chose to represent them in the form of a tulip. And so anyone holding a tulip has lost a child to the system and hopes for them to return. Next, everyone may have a bunch of popsicle sticks. Grab all your popsicle sticks that are wrapped up in an elastic, and you're going to hold those in your hand. So this is as far as PATH goes into personal vulnerability. So anyone holding a popsicle stick, each household member that has a mental health, a physical health, an addiction, or a disability, whatever household members have those items, they get a popsicle stick. And so you might see somebody holding one popsicle stick. That means there's one condition in their household. You might see people holding a lot of popsicle sticks in their hands. And so this is as far as PATH goes into vulnerability. We don't dig into what are the types of mental health, what are the addictions, what's your trauma history. So these conditions do impact the household in accessing and retaining housing, but that's as far as PATH goes into vulnerability. So you're gonna see everyone on the floor holding a stack of popsicle sticks, and if they have none, that just means that they don't have any of those conditions in their household. Next, you're gonna see each player on the floor with a bag, a plastic bag. And in that bag, Jillian has not done her homework and built her wall, but everyone else should. So in that bag should be a Lego wall. And this is where PATH flips the script on its head. So this wall represents the number of barriers and obstacles within that home that's stopping that person and getting in their way of accessing and retaining housing. And there's a little sticky note in their bag as well with the number. But these are systemic factors. So this is moving away from personal vulnerability, and this is where we get into what's wrong with the system. And how can we change it to end and reduce homelessness? The next thing you're gonna see is length of time homeless. So these are our paper chains. So if you could take your paper chain, if it's really long, you can wrap it around your neck. If it's short, you can wear it as a bracelet, however you want to wear it and feels good to you. So this is the length of time homeless by the person's definition. So not the system's definition, not the organization's, and it's also over their lifetime. So over their lifetime, how long have they experienced homelessness based on their own definition? Now, some people will also have a little white clip. You can wear that white clip just like on your coat or just on the edge of your shirt or on your sash. Thank you. And this clip represents chronic homelessness. So these are people that have experienced at least 6 months of homelessness over the past year, or a cumulative amount of 18 months over the last 3 years. So you're gonna see some people with a clip, and they meet the system's definition of chronic homelessness. The last piece you're gonna see is a white tag. And everybody picked their favorite month, their favorite day, and their favorite time of day. And what was interesting is that was the hardest question I asked anybody, was what's your favorite time of day? So if everyone could put that on their shirt, I think it sticks better to the shirt than your sash.
And is anyone missing?
And if you're missing one, Jolyn can bring one over. So this is their hypothetical or fake intake date and time that they're wearing.
And bandanas.
Oh yes, so bandanas, if you could take those and just hold it for now, because once you sit back in your seats again, I'm gonna end up getting you up and then back in your seat. At that point, I'm gonna ask you to place it on the floor in front of you. So you can just hold your bandanas for now.
And is anyone missing a bandana?
Oh, behind you. Okay. So today you see everybody on the floor wearing their story. They are now wearing props that represent their story of homelessness. All these pieces of their story are specifically linked to the prioritization component of PATH. And we're gonna see how those pieces of their story filter in to if they're awarded a housing opportunity. So first you see on the screen, this is PATH and coordinated access. We're gonna focus on steps 5 to 7 today, which is the prioritization component of PATH. So it's after you go back to your computer, You put the information into your database, and then that information is pulled out of the database, and it's organized according to a bunch of rules of logic. And those rules of logic we call the intersectionality matrix. It's a fun word for rules of logic, and they tell us how to organize a housing list from top to bottom in order of priority. And those rules of logic, you're going to learn what they are today through the grid on the floor. So the grid on the floor, we're going to fill that grid today, and by the end of it, you'll understand perfectly all the rules of logic that are used in that matrix and help create the housing list. Housing lists are just a starting point. They are not supposed to say, hey, the first person on that list gets that housing opportunity. What comes after that is a decision-making process and a matching process. And so we're also going to explain that. So first we're going to start with creating our matrix and creating our housing list. There are 3 priority groups, which you see on the floor in front of you. They're heat mapped between red, orange, and yellow. The red category is immediate priority, the orange is high priority, and the yellow category is priority. Each of them are use the term priority, and that was intentional to ensure that we remember that everybody on this housing list is priority, whether they get the housing opportunity or not, or whether they're at the top of the list or the bottom of the list. On the first row at the very top, closest to me, everyone in this row has 2 things. They have an urgent safety concern as well as children in the home. So there's something urgent in that home. Someone's life is at risk in the next 24 hours, and there's children in the home. So that's all my snowy owls. So if my snowy owls can come up to the floor to where Jolyn is.
And I'll ask you to join us here in the first top row. And you may not need your bags if you have all of your props in your hands.
Okay, so all of our snowy owls, they also have conditions in their home. So they have either, one of their members has mental health, addictions, there's a disability in the home, or like a physical health condition. Next, I'm going to call up the eagles, and they're going to go on the end here. So all my eagles, can you come up to the floor? The eagles are going to go on the end of the line. The difference between the snowy owls and the eagles is the eagles don't have any conditions. So health status is good. There's no mental health, addictions, disability, or any physical health in the home. And so the first thing we're going to do is, now we've got this big line, but how do we order it? It's kind of jumbled. We don't know. There's a lot of snowy owls, but how do we order it? And so the first thing we're going to do is we're going to look at number of conditions. So if all our snowy owls could order themselves by number of conditions, with the highest number over here by Jolyn.
And I'll help you. So we've got a 6 and a 2 and an 18. So Vince, I'm going to pull you to the front of the line. And you have 2, so stay next to her right now. Need that. And you have 3, so I'm going to bring you over here between you 2. And you have 6, so come with me, Tammy, and you can stand next to her. And you have 9, come with me, so you'll be right next to Vince. So we've started there, but we have 2 ties of 6 and of 2.
Okay, let's have the tie of 2 step forward. Okay, so there's a tie of 2 here. So the next factor we're going to look up is number of barriers and obstacles.
So I see from your brick wall you have 90 and you have 20. So you're in the right order, so you can step back into place.
And then there's another tie of 6.
Yeah, so I'll ask you to take 1 step forward, and you have 60 barriers and obstacles, and you have 60 barriers and obstacles, so still a tie.
Okay, so since there's a tie there, we're going to go to length of time homeless, so the chain that each person is wearing.
Okay, so I see I have 3 years, and then and 22 years. So that will break the tie. So you'll step back into place as you were.
If there was a tie for length of time homeless, then we would go to date and time of intake. And you can see the tiebreakers in the right-hand corner of the screen in the blue box. So I'm going to ask you to stay in this row as we go through the rest of the matrix. And I apologize because you will be standing the longest out of everybody. Okay. So the next row is anyone that does not have an urgent safety concern. So there's no urgent safety concern in the home. But
I'd just like to check we don't have any ties between the eagles.
Eagles don't have any conditions. Oh yeah, but you could go then to number of barriers and obstacles. That's correct.
So how many do we have? We have 40 and 80. So Caitlin, I'll ask you to swap places. And we're all set.
Thank you for that. So next up is anyone that does not have an urgent safety concern, but they do have current or risk of CFS involvement.
And what's our code word?
Goose. So all our gooses, can you come up to this stage?
So I'll ask you to line up in this next row.
And yeah, my apology for the first row. They might be coming from behind you there.
So I have 1, 2, 3, 4 geese.
Okay, and all the geese, they have at least one condition in their household.
So let's start there.
Yes.
Okay, so I see 3 conditions and 1 and 3. So I'll ask you to come scooch here, and 2. So I'll ask you two to swap places. So I have 1 tie with the 3s.
1 tie with the 3s. Okay, so now we're going to go to number of barriers and obstacles.
So I have 40 here and 50 here. So you're in the right places.
Okay, perfect. So next I'm going to call up the loons. And so the loons, the only difference between the geese and the loons is that the loons do not have any conditions. Is there any loons?
It looks like our loons flew the coop.
Okay. So no loons today. Okay. So our next line is going to be people that have an urgent safety concern in their household. So someone's life is at risk in the next 24 hours, but they do not have any children in their household. So they're all adults and or seniors. And so the first group I'm going to call up is our ravens. And our ravens are very specific because they are having at least one senior in their home or somebody from the 2S LGBTQIA plus community. So if we have any ravens in the room, you can come to the floor now.
Our ravens have also gone south.
Okay. So if we did have a raven, it's because they have a senior and or somebody from the Two-Spirited Plus community, and they have at least one condition in their home. Next, we're going to call the hawks. The hawks are an all-adults household, and they have at least one condition at play in their home. And it looks like we just have one hawk. So so we won't get to any tiebreakers there.
I'm actually going to ask you to stay.
Next, I'll call up the herons. So the herons have a senior and or somebody from the Two-Spirited Plus community, and they have no conditions in their home. So no mental health concerns, no addictions, no disability, and no physical health concerns. And lastly, I'll call up the crows. The crows are an all-adult household, and they also have no conditions in their home. And since we just have one representative from each of these groups, we won't be moving to tiebreakers. But if there was a tiebreaker, we would first go to number of conditions, then number of barriers and obstacles, finally to length of time homeless, and then over to date and time of intake. If we ever had to get to date and time of intake, we could go all the way down to the minute. So there should be no ties after you apply all of those levels. The last row of our immediate priority category are people with no urgent safety concerns, but they do have children in the home. So all of our children are in the immediate priority category. You're not going to find any children in high priority or the priority category, so in the orange or yellow on the floor. So first I'm going to call up our hummingbirds. Is there any hummingbirds in the house?
Great, Bonnie, right this way. Oh, so I'll ask you
So
to
this
stand.
hummingbird has children in the home and at least one condition.
And so we have 2 of you. So we'll start with a number of conditions to break your tie. So I see you have 3 and you have 6. So you're in the right places.
Next, I'm going to call up if we have a chickadee. I think we had 1. Okay. Oh, there you go.
Come right over here.
So the chickadee group is represented by having a condition in the home. They don't have any children currently in the home, but they will be holding a yellow tulip because they have lost a child to the system and they're hoping to be reunited. Next, I'm going to call up any woodpeckers. Any woodpeckers in the house? 1 woodpecker. So this person does not have an urgent safety concern, but they do have children in the home, but there's no conditions in the home. And lastly, I'm going to call up any robins. Do we have any robins in the house? There we go. The robin is the same as the chickadee in the sense that there's no urgent safety concern, there's no children currently in the home, but there is a child that's been lost to the system and there's hope for reunification. And so this closes our immediate priority category. Everybody that's standing within the matrix right now is in the immediate priority group. And so next we're going to go on to high priority. And first I'm going to call up our bears. Is there any bears in the house? Our bears are either, they have at least 1 senior and or somebody from the two-spirited LGBTQIA plus community. And they also have at least 1 condition of mental health, addiction, disability, or physical health concern in their home. So the first thing we're going to do is order by number of conditions.
So I see 2 here, 2, 1, 2. So Mac, I'll ask you to swap places here. I see another 2, so another swap. 1, and Mark has 3. So I'm going to bring Mark to the front of the line. But we have multiple tiebreakers. So for the 2s, I'm going to go next to barriers and obstacles. So I see 80 and 90, so I'll swap the 2 of you. And 60 and another 90. So come with me and we'll pop you here. So then we need to do a tiebreaker for our 90s. So then we go to length of time homeless. So I see you are 2 years and you are 6, 7, 8, 9, 10 years. Okay, so you're in the right places now. And moving further down the line, we have 2, and did I get that right, Mac? Yeah. So then we have 1 condition, and they also are tied for their barriers, 40 and 40. So next we'll move to length of time homeless. So I see you have 4 years, and you have 5 years. So I'll ask you to swap places.
Next in our high priority is all adult households with conditions, and those are our wolves. I know there's a lot of wolves in the house, so come down to the floor, please. So since they have no conditions in the household, we're going to start with the tiebreaker of number of barriers and obstacles.
Okay, so first I'll take a look at your conditions. So we have a 3 and a 1 and a 1 and a 2. It sounds like a dance step. I'm going to scoot you right in between here. And further down here we have another 2 and another 2. So I'll swap you 2 ahead of the 1s. So we have a number of 2s. So next we'll go to number of barriers and obstacles. So I have 40 and 60, so you can swap. And 70, so I'll ask you to come to the front. And they did it for me, 40 and 20 for the 1 conditions. So we're all in our right places now.
Great. The last category in the high priority is our moose. So if you're a moose, come to the floor. Our moose have at least 1 senior and or somebody from the two-spirited LGBTQIA plus community, and they have no conditions. So we'll move right into barriers and obstacles.
Okay. So we have 2 moose. So I'm first going to no conditions, right? Okay. So I'm going to barriers and obstacles is 70 and 20, so you're in the right places.
Our last category is all adult households. There are yellow priority category, and there's no conditions in the household, and they are our turtles. So if you're still sitting, you should be a turtle. Come on down.
We have 4 turtles, so the last row. So to do a tiebreaker here, we're going to go to barriers and obstacles. So I see 60 and 30 and 20 and 60. So David, I'm going to ask you to come next to Mark here. And from there, we're going to go to length of time homeless. So I have 8 months and 1 month. So you're in the right place. So we're all set.
So now we're going to create our living housing list. And so Jolene's going to come up here to the top. Don't move your order. Jolene's going to lead everybody in. You are going to be sitting in a different seat, but don't worry. You can grab your stuff at the end of the presentation. But if you could lead Vince right down to the last chair over there.
So Vince, follow me. And so Vince's row, follow him and have a seat there, Vince. And you'll all sit next to each other in order.
So we're now applied the logic of the matrix, and that's why people are sitting in different seats, is that you see now that the logic's been applied, we have created a living housing list organized by the prioritization criteria within the PATH framework.
And then, so the next row, I'm going to ask Ray to have a seat here. And so you 4 in this row can take these last 4 spots.
So Jolene, if you could do that off mic, and then I'm just going to speak a little bit to the housing list and how this logic was created. And so early on in the project, we asked many Indigenous voices from coast to coast to coast, how do you already prioritize for housing? And we used that Indigenous knowledge, and we only took the common threads that ran through all the narratives. So everyone said we prioritize our children and youth. We especially prioritize those children and youth that are at risk or involved with the system. We prioritize our elders and our seniors. We prioritize our two-spirited communities. We prioritize those people with those conditions, so mental health, addictions, disability, and physical health. And so we took all of those common threads, and those are the only ones that you see within the prioritization criteria of PATH. If some communities said veterans or women, we didn't include those in PATH. And it's not that they can't still be in there, which you're going to learn as we go through the rest of the prioritization component for PATH, but they're just not involved in the matrix logic. So they can be applied later. So just keep that in mind. So now everybody is seated, and we see the very top of our housing list down here. Vince, wave. Okay, and if everybody could take their bandana out now and place it in a big square in front of you. So you're going to see that people with a red bandana in front of them are in the immediate priority category. People with an orange bandana are in the high priority, and people with yellow are in the priority category. Okay, now we're going to use a mock housing opportunity, and only one of the people on the floor are going to be awarded this housing opportunity. This represents the housing stock in communities. There often are many people on a waiting list, but there's not enough housing. And so you're going to see lots of parallels to the system as we go through this demonstration. So I'm going to have everybody stand up, and when each of the people on the floor is standing up, it means they are still eligible for the housing opportunity. Once they've sat down, it means that they are no longer eligible. Okay, and so we're going to go through an exercise. First, we're going to learn about the housing opportunity at play. Kyle from Vancouver, one of our pilot sites, is going to get up and tell us a little bit about a housing opportunity that we're going to use today as demonstration.
So we've got a 2-bedroom with a small second bedroom. So if you're a single applicant, then you're excluded.
If you have,
All right.
you have a
Oh,
if you have a family of who needs more than 2 bedrooms, you'll also be eliminated. So have a seat.
that was more impactful than, than I thought.
So that's a good demonstration, and one of the things we've really learned through PATH is that the housing opportunity has a huge impact on the waiting list and who's being housed and who's not being housed. And so the housing opportunities that are in a community, this is some of the data that PATH is collecting, is who's on this waiting list, and when there is a housing opportunity, who are the people that just aren't being chosen simply because the housing opportunities that they need don't exist.
All right, so it's also rent geared to income, but you must be able to pay some rent. So anybody who can't,
Okay.
much better, okay. It's unfurnished. I don't think that will make much of a difference. Has an in-suite kitchen. Applicants with, okay, I'll get to that after. It is 3rd floor with stairs and no elevator.
So if you have mobility needs or in a wheelchair, please have a seat. Okay.
And the building generally has minimal accessibility features and virtually none in the unit. No smoking and no pets.
So if you're a smoker or a pet, have a seat. Okay, so we have 3 remaining applicants.
Okay. So now I'm going to ask Kyle to pick 2 out of the 3 applicants. And so you can imagine that he doesn't actually have access to their full files in the database at this point in time. He's just looking at a housing list. And what he can see on that housing list is, A, he can't tell who it is. There's no names, so it's a non-identifiable housing list. And B, the factors that he can see on that housing list are the prioritization factors that they're wearing. So he can see who their household members are. He can see if they're a part of the Two-Spirited Plus community, their length of time homeless. He can see if they're experiencing chronic homelessness. Anything that they're wearing is what he can see. So he can't actually talk to the participants yet, but he can make his decision based on the props that he sees.
So Kyle, firstly, we have an older youth parenting a younger youth, and they're both at risk of CFS involvement, and they've been experiencing homelessness for 3 years. Next, we have 2 adults with a pregnancy at risk of CFS involvement. We have urgent safety concerns with both of them. We both have conditions affecting their ability to access housing. And they also have a child in the home that's at risk of CFS involvement here. And thirdly, we have an adult who's part of the Two-Spirit community, and they have a child in the home at risk of CFS involvement as well. Anything else you'd like to know?
We are going to apply our equity targets because he will be able to see that as well. And so the first equity target that you can apply to the housing list to see. And so just so you all know too, equity targets come from the data of your community and your community's priorities. And so the first one is Indigenous. So there's overrepresentation of Indigenous people experiencing homelessness in the community. So they have an equity target for Indigenous people.
So if your story is Indigenous, please take 1 step forward. You're not eliminated, you're still in the game.
Next is if they are experiencing chronic homelessness. So if you have one of those little white clips on you, that means that you meet the definition for chronic homelessness, and you can take 1 step forward.
I'm picking the 2 Indigenous applicants.
Okay.
And so can you speak to a little bit about your thought behind that?
Yeah, so actually I had written in my housing overview that Indigenous applicants would be prioritized. And I think I guess if I'm thinking about it from a systems perspective, recognizing the additional barriers to access housing. As an example, in Metro Vancouver, the point-in-time code comes out every couple of years and states that Indigenous people are up to 12 times less likely to be housed than the rest of the population. And so there's challenges like that I think need to be responded to.
So now you've seen we created our housing list. We went through our housing eligibility criteria. We also applied our equity targets. We've picked two, in this case two, in a larger, actual housing opportunity that's occurring in a community. You might pick up to 4 people from that housing list. In this case, we just have 2. And now we're going to apply the matching process. So this is where we get into more of the strength-based piece of PATH. And instead of just picking somebody from the top of the list, you can look at their entire file on HIFIS or in the database and get more information to help you make that decision. That decision can be made via a table of people or an individual role. Mm-hmm. So Kyle, now you have access to their entire file, so you can ask them questions that you might find within the database. You can also reach out to their support workers if you want.
All right. How about strengths? Did you ask to generate strengths?
Yep.
Okay, strengths. If you could tell me your strengths.
Resiliency within the medical field and navigating that. Okay. In this home, there is a mom with a mental health issues, and then also the child struggles with both mental health and physical health, and being able to have a stable home where that can be prioritized for both the youth, the parenting youth, and then the child, I think would be ideal.
And so what parts of this housing opportunity will play to your strengths?
So as she's thinking, just so you know, to the strengths part of PATH, so when a staff is sitting down with somebody, sometimes it's not appropriate to ask the person their strengths. It's just not the moment. They're in survival mode. And so the way we do strengths within PATH is if somebody is able to speak to their own strengths, great. The other way it's done is that no matter what, that staff needs to be identifying a strength that they see in that person. And they don't even have to verbalize it, but you do need to record it in the database. And so that way, when that staff is sitting with that person, even if somebody can't speak to their own strengths, and even if it's not appropriate for that staff to verbalize what they think the strengths are, they need to be thinking of it, because that is their mindset in that moment, and that is truly working from a strengths perspective. Yeah, so a strength could be somebody who's very resourceful, somebody who's very resilient, intelligent, maybe a really great mother.
Mm-hmm. Someone who's really community-minded, so we know that that housing opportunity could really play to that they could become part of a new community. Does any of that feel like it could fit you?
I was also employed at the time as well. And yeah, just resilient and in early recovery.
Amazing. And so do you want to ask any other questions or about the housing vision or anything?
Vision, yeah.
So can you tell me about the housing vision that you filled out? What is your dream place and why is this a great fit for you, this apartment?
I'm going to be honest, I didn't fill it out because I didn't have a pen. I think having a 2-bedroom space is ideal because as a youth parenting a child, it's not easy to have a shared space, and it's convenient to be able to have both the youth and the child have a safe space for themselves. And then also, this youth has been on a recovery journey for about 2 years now, and so really that stabilization piece is ideal for them. Yeah.
And so why is this 2-bedroom a really great fit for your family?
Well, I won't be sleeping in my car. And it would be a chance to start over. I'm pregnant with a new baby. My daughter is currently not in my care, so getting her back would be important. And I need to show my family that I can stabilize so they will accept me again.
Beautiful.
So Kyle, the clock is ticking, and the reason this is so hard is that there is no right answer at this point in time. Both people deserve the housing opportunity, and it's really not that one person deserves it over another. At this point, we're just making impossible decisions. So here's your impossible decision.
So just as a review, we have an older youth parenting a younger youth. They're both at risk of CFS care, so it's the 2 youths together. And here we have 2 adults with a baby on the way and a child as well.
I'm going to pick the 2 adults with a baby on the way and a child as well.
Okay. So Marcy, have a seat. So now I'll play the support worker.
First, can we just hear your logic behind that?
Yeah, I think the pregnancy aspect and the chronic homelessness weighs heavily here. It's, in a brutal sense, more lives at stake. And I think getting out of chronic homelessness and having an opportunity to get out of chronic homelessness is a high barrier to get over. And so if there's an opportunity to do that, even if this housing opportunity ends up being somewhat temporary, depending on the age of the children as the kids get older, it's still more lives impacted in this case.
So a new part of this exercise that we implemented is recognizing what a change it makes for between the support worker that's been along the journey, along with the living experience person when that housing opportunity is awarded. And so now we do a small ceremony where your support worker, who I'll be, is breaking your chains of homelessness. So you are awarded this housing opportunity. So
There you go.
well done. I'll give you this ticket. Yeah. And so, as you can see, there's quite a lot of folks who are experiencing homelessness still on the waiting list, but we have a small gift of thanks for those who were considered.
And we'd want to be open and transparent, like if you were those people that were still standing in the end, those last 2 people, that you understand why you weren't chosen for that housing opportunity. And so that's why I was asking Kyle, like, what was your logic behind that? And so we want to be really open and transparent about that. And then as good as that felt, and like the clapping almost didn't feel good to me because there's so much homelessness still on the floor. So if everyone who's seated now can you put out the demonstration props in piles?
Yes.
On the floor. So Jolynn is going to place the demonstration props in different categories of piles on the floor. And then if each interactive participant could go up to those piles and place their props on there, and then you can go back to your the seat that you're currently sitting in, because we're going to do a debrief, and I still want you sitting in your current seat. Thank you. So as that's happening, I'll just read some of the quotes from our pilot communities. From Whitehorse, we hope PATH will help grow relationships between our sectors. In Vancouver, we have the PATH team makes space for everyone to speak. In Cowichan, we have PATH feels like the medicine we need.
Your yellow sash.
Over in Halifax, we have PATH is two-eyed seeing for Halifax. In Thunder Bay, we have PATH is an important step towards a more culturally safe and informed coordinated access system in Thunder Bay. And over in Winnipeg, we have PATH is healing for our people. Yeah, so just make sure you sit back in the seat for the housing list. So you're the one that you were sitting in for the prioritization.
You could drop the rose somewhere. Oh, don't worry.
It's not working.
It's fine. It's not the end of the world. So as you see on the floor, the reason that we do this at the end is it's symbolic of the homelessness that still exists. And this is how our current system operates, is that we do have one housing opportunity that comes up, and then we still have hundreds of people possibly sitting on a waiting list. And so on the floor, you see those urgent safety concerns by the red roses that are still there. You see the children that have been lost to the system in the tulips. You see those months of homelessness and years of homelessness. The white is years of homelessness, and the red links are months of homelessness. You see the conditions that are impacting people over in the popsicle sticks pile from accessing and retaining their housing. You still see the chronic homelessness that sits on the board, and that giant pile of barriers and obstacles that's really in people's way of accessing and retaining housing. So now we're going to do a bit of a debrief. And so we don't have, ideally in community, when we do this in training, we have each person that plays in the exercise. We have a circle to close this activity. But today I'm just going to ask for us to do it popcorn style, and Jolyn will have the mic to bring around. But I'm wondering if anybody wants to speak to their experience of being in this prioritization exercise.
Marcy. Thanks, Julie.
Hi, my name is Julie, and I was homeless, and I got a place to live, and the criterias were very different, and I thought it worked really good because I'm the one who got awarded, but though I was at the end of the line. And how it works, it was based on what are you willing to do to sustain your housing? I'm in recovery. I have a social worker. I have NA, Alcoholics Anonymous, a psychologist, trauma therapy. I do volunteer work. I'm invested in the community. I've done therapy for domestic violence. I have a medication for anxiety, a psychiatrist. I've conquered depression through the process. And so they gave me the place because I am the highest rate of keeping it. And if I have kids, then I can do parenting classes and I can have help and ask for a social worker for my kid. So they give it to me. So the way you guys do it, it's okay. But if you give a nice apartment to a crackhead and it end up in a crack house, that was the point. They need to be able to sustain it. And I've been there for a year, but then you have to commit to what you say you're gonna do. And I have been one of the phenomenal success in Montreal of one of those people who has sustained this apartment, and I was a whore for crack. So I don't know about this. I'm a bit frustrated. But it's okay.
That's okay. Thank you for your honest feedback.
Experience, right?
Yeah.
All right.
So I forgot to mention something about PATH as well, is that it's to be tailored by each community. And so even though the matrix logic that you see in the floor in front of you, that is something that's the same between all our pilot communities. Those equity targets, community priorities, and the way they choose somebody for the housing opportunity, that's up to the community. So if a community wants to integrate that process of within the circle guide piece down here, of choosing someone that, in that matching process, choosing somebody that they know is going to be able to retain their housing, that's a piece that you can add into the circle guide. So thanks for demonstrating that.
I found it actually really interesting the way that you guys did it, because I'm from Calgary, and we work with a nonprofit agency that supports pregnant and parenting youth, and our intake process is very similar in terms of that priority, where they're all priority, but gauging it on best fit, the ability to maintain and sustain their housing. And all those different factors really play into it. So it's interesting to see how that could be reflected in a not so niche population.
Miigwech. Anyone else want to speak to their experience? We got one hand over here, one over here, and then two over here too, Julie.
Yeah, I was actually surprised that I was standing, and because when I was standing in this line here, I thought, well, there's so many people behind me in this urgent need category with, 24 hours and all of that. I didn't think I was going to be one of the last three. And I totally understood the reasoning behind it. But I also think it's very interesting what Julie said, because I work with an organization and we are an abstinent-based transitional house. And we do use that mindset of, is this person able to maintain, and can we assist them to maintain? Because as she said, if you give a house to someone who's not ready, simply because they're on the list and they trash it, there's a lot of issues with landlords because of that. So thank you. It was very interesting.
Coming to you, Rebecca.
Just being a part of this was just really interesting. It really made you really feel like, and this was a small list if you look at, real life, but just really felt like I'm not going to be priority. I don't know. That just kind of really made that just my experience. But it was interesting, the process that you did this, though. Yeah. Mm-hmm. And I have to say, I kind of agree to a point. I feel like that should be. And I hear that you're saying you can tailor it, but I think that is part of it, or that there's programs to train, but teach people how to look after themselves because you can give someone a home, but there's some people that have left, even though they've been sheltered, given a place, but they've gone back to the encampment because it's so quiet and they don't know how to take care of themselves, so.
I see Rebecca. Is there one? Oh, Mark.
So this is the second time I've been able to be a participant in this exercise, and what I found is, although I agree with some of the things Julie said, it also illustrates how upside down the system is. You're lucky you were able to pull your boot, you were able to get yourself and do what you needed to do, and hey, good for you, and I'm very happy for you to make those changes. But let's face it, not everybody can do that. Some people need a home. Housing is a multifaceted approach. There's not one way that fits. So like your transitional house isn't going to work for everybody. Some people need to have the home to get better. So there needed to be a system that could look at things differently and flip it on its head. And that's what the elders that were part of this, that's what the people that talked, that how this whole process came about was, we have to do something different because what we're doing now is not working and people are getting left behind. And and housing, I'm a housing provider. I'm going to go with, sometimes you're going to go with what's easiest for you. So it just shows that the system needs to work harder, and the programs and services have to understand that there's people that have those needs, and those needs have to be met because everybody in Canada and this rich country deserves to have dignified housing.
3 more?
There's one over here.
Oh, okay. Miss you?
This exercise was really, really, really great, and it just made me think of my organization and my program and what we do. We support a shelter for queer refugees in the city of Toronto, and we do the intake part of it, the program that I manage, and yeah, we get a lot of applicants for shelter, for the shelter, and there's only 20 beds. But because of a whole lot of applications coming in, referrals, we end up doing like a needs assessment of everyone who applies. And it's like, wow, everyone who we just basically we prioritize the people who we have to prioritize. And then it's like, everybody else. It's like, I mean, we try to stay in contact with people. We provide them with resources to all the alternative resources in the community. But it kind of makes you think like competition of resources, and that's like a problem with larger society. And it's kind of like, yeah, everybody's kind of like fighting for it, right? So yeah, thank you.
I have one here and one over there, and Kyle.
There's a lady there too. She's had her hand
Okay.
up for a while.
Oh,
The lady in the circle, right in front of you.
again? Okay.
To add to your point, I agree. I also think the biggest lack in the systems is the lack of education around how to maintain your housing. And especially for youth and people that haven't been able to maintain it for a long time, a lot of it is because they don't know how to. And so really just teaching them those life skills and the ability to be able to maintain their housing is just as important as securing the housing.
Yeah, so I do eviction prevention for Safe at Home up in Whitehorse, and then also do intakes as well. And yeah, I think like to echo what a lot of people are saying is that people oftentimes need something to, like our shelter, like in the Vispadats, if someone's staying in a shelter, you're not awarded that like point or whatever because you're considered to be like supported in some capacity. But we literally have people in Whitehorse in -40 who would rather sleep outside than be in the shelter because of the risks that are there and like the amount of violence that is there. And so we see a lot of things like recovery and like all of this stuff is almost impossible because they're staying at the shelter and like the access to programs requires so much. And people have like been housed who, if you were a landlord doing reference checks or doing like a background check on somebody or whatever, you would not pick that person. And I've seen like a lot of really good successes coming out of, and like not everybody goes into an abstinence, not everybody, but like when we think about people who are outside of that process looking for housing, like I have lots of friends who drink, I have lots of friends who probably recreationally use drugs, and they're housed and they're successful and they do things, they main things. So there's this sort of two expectations that like, oh, you don't get to get housing because you're in this category. But we have to also allow people the opportunity to, and we also to just in Whitehorse, we don't just work with like landlords, we work with government residential, low-income housing, and they have a willingness to work with us, and because they're not trying to make money off of it and all of this other thing, it's government funded and all this thing. We can work with them. There's a little bit, and we're not putting somebody's investment at risk. It's a little bit different in that regard, but I think that's like. Yeah, I just think like it is very possible to see people come through, and I've also seen the opposite is like when people have not gotten housing, how quickly they go from like, if it's only been a month since they've had housing and things are like not good, but like not the worst. And then sometimes you lose contact with them and you see them again like a year later, and like not having housing hasn't made it better for them. Like, so I think that's like a thing to be, just to put in there.
I have Louise. Yeah. Louise, and then I have one.
Hello. Okay. So I work in Sudbury, and we don't have a program. We run the service. So for us, everybody that walks in the door is the priority. That's how we treat them. If we can house them, we housed 11 this last quarter, in the last 3 months. So it's just whoever comes in, that's who we work with on a daily basis. We don't have a priority thing going on there. There is no housing. There's no social housing. It's full. It's a wait list up to 5 to 10 years. So it's trying to find market rent is trying to find rooms that are affordable, which there aren't. So for us, it's everybody who comes in the door is the priority. We will do our best to get you housed and housing ready. And other than that, we don't do, like I said, we don't do priority. We have the homeless network that we work with. If we can't get them housed because they're on OW and there's no rent subsidy, then we make the referral to the homeless network, or we make it to another program that we know can help get them housed. That's all I wanted to say. Miigwech.
Kyle?
I just want to highlight a couple things. First, the frustration that you're experiencing, very real and very valid. I think that there's an endless amount of frustration in any housing selection process. As we see with all, one person gets selected, nobody else gets selected. And I think that the example we're going through here, and I'm speaking as one of the communities that has implemented this process now. The example that we're going through here is a very, very simplified process. We're going through it in minutes, whereas realistically in our system, you're going through it in days, maybe it takes even weeks. And so when I'm coming up kind of with the housing opportunity and how I'm selecting, that is in some senses a real reflection of at least the way that it works in our system is it's up to the organization to ultimately choose who's going into their housing resource. Some organizations are going to choose along the lines of this person's the best fit for this housing. They're going to choose along the lines of this person's most likely to succeed in this housing. Some organizations are more focused on working with people who would be described as the harder cases to work with, more complex needs, things like this, because we need to have a housing system that responds to all people where they are, ideally. And it just so happens that in this particular example, I think it painted a bit of a narrative that, this is how the path process works. But that's actually not the case. The path process is very, very much, in a sense, kind of a decentralized process where organizations are individually choosing. We just provide them the prioritized list. And I think usually in other times when we've gone through this process, it can be a little bit more clear, because one thing that happened kind of unintentionally here is when I put a 2-bedroom, everybody who was left standing was in the immediate priority category. But actually, often what happens is that we end up with some people who are high priority, some people who are priority. And so it becomes much more clear that the selection process is more about who's the best fit for this housing. And I think in reality, you would end up talking about strengths a lot more. And those skills that you mentioned that that you've developed, that would definitely be part of that conversation for a lot of service providers. So I just want to be clear that it's all one way and not the other. It is malleable depending on the organization, and I do think that this simplified nature of this, which I think does bring a lot of value personally in understanding sort of how the prioritization happens. But I think just the luck of the draw in terms of the way this came out on the other side, it painted a little bit of a narrative that isn't necessarily true to the process on the ground.
Thanks. I had this lady.
Just a question. What is there anything for the person that was like the runner-up? Essentially, do they stay near the top of the list, or do they go back to the bottom? Is there any kind of supports if they got up that far with the priority, or do they just go back in the same process for the next unit?
Yeah, he can speak to that based on his own community.
Yeah. And one more thing before, and then he can speak to it. I just wanted to say I work at a friendship center, and really, as an Indigenous woman, I think, you need to meet people where they're at. Our population, we're overrepresented with everything. So all bad things we have the highest stats for everything. If we didn't help people that, had concurrent disorders and whatnot, there would be homelessness forever. So the other thing to that is that you know, I know it's not good to celebrate we know that that other person didn't get the unit, but I think it's okay to relish in that person that you did help, that you did get that one person that day off the street into a unit. They shouldn't have to feel like somewhat of a survivor's guilt because they got the unit and other people didn't. It's like, this is the beginning of your new chapter, you know? So I just wanted to make that point to you.
So I'll just respond to the first comment. I think for us, we recognize that a lot of the work that we're doing, this is the beginning of a very long journey that's going to require a lot of learning. And it's the data that teaches us, what is working, what's not working. And this includes, how the path process is functioning. The path process that we have in place today may not be the exact same path process that we have in place a year from now, 2 years from now. And so, while we can't really offer a real concession prize, if I'm being brutally honest, to somebody who's second place and not selected, they probably wouldn't even be aware that they were close. But systemically, the way that we've implemented the path process is we track instances of how often do people come up in searches in the housing wait list. We track instances of, okay, so how often was their data expanded? How often were they then added to a caseload but then not selected? And so we can start to learn and start to assess and start to truly recognize what is actually happening in terms of the selection process across the community. And we can start to pull on those levers. But at the end of the day, we have less than 1% vacancy rate in Metro Vancouver. So what we're building here, I think it's hopefully not controversial to say, is primarily a data collection exercise. It's a housing exercise, unfortunately, second, because there's no housing. And so I think that what we have to do is we have to be aware of, what kind of information are we collecting? What's the purpose of collecting that information? Of course, it has to be explicitly applied to when you're looking for a housing opportunity, but it also has to play into the advocacy side of things, where we're understanding what is needed, who's not being housed, who's not even coming up in searches. I have a fear in Metro Vancouver because the need is so great. As an example, I think there's 14,000 families or over 14,000 families on the co-op housing wait list in Metro Vancouver, and those are people who are on the verge. There's, again, well over 10,000 people on the housing wait list for, BC Housing. We're talking about like a small town worth of people. My concern is that, anybody who has needs above a 3-bedroom, they're never going to come up in searches. Because the way that our wait list works is we force service providers to specify the housing requirements first, and then we will return results, because we didn't want to just return a big list of all the people who are looking for housing immediately out of the gate. That was a privacy concern. But then what we will get out of that is we will get data to show there are all these people who are not coming up in searches. This will tell us that of the housing that is on offer in Metro Vancouver, at least connected to our system, here are the gaps. And unfortunately, at this point, realistically speaking, the housing crisis isn't going to turn around anytime soon. That's kind of the best that we can do. And so I think when we're talking about concessions, I think realistically, that's probably the best that we can do, is we can start to arm ourselves with this information to then hold funders accountable, and to hold the people who are planning what type of housing we're going to fund, what type of housing we're going to build, how much housing do we need, how many bedrooms does it need. We can gain an understanding of the need on the ground.
I just wanted to sort of connect to what you were saying, Kyle, and link it to the session for those who were in Loretta's talk this morning, to connect that the real problem here isn't that sometimes we prioritize people who are in a recovery journey and sometimes we prioritize families, and sometimes that's not the problem. The problem's the system. And I appreciate that you're attempting to flip a system on its head to try something different. It's not perfect like everything else, but I appreciate the effort, and I hope that everyone can, with the experience, really see each other in this room as allies who are all working towards the same thing. Otherwise, we would never attend a conference to end homelessness.
We've got 2 minutes left, so that's 1 to 2 more people max. Thanks.
Hello. Hello, everyone. My name is Siobhan. I'm from Vancouver. And what I wanted to say in terms of the housing program that I run is, yes, like in terms of the family size, culturally, we serve Black identified individuals and family throughout Metro Vancouver. Definitely overrepresentation in terms of homelessness stats. But the main piece, the piece that we haven't mentioned today, is around capacity. When we talk about a 2-bedroom, I have families of 6 sitting and living in a 1-bedroom, but I can't get them into 3 of them into a 1-bedroom because that won't be allowed. I had a single mom who was on the verge of homelessness, had just given birth. Co-op came up, a studio, did all the stuff, and then got denied. She couldn't go in. I'm like, the tiny little baby's not taking up any space at all. Could not. And the thing is that these are meant to be guidelines. They're meant to be guidelines. And so that person, that single mom that was denied what would have been affordable housing for her at that incredibly vulnerable time would not even be considered for that studio. Right? When you talk about what is the housing that's being made, who is it meant to serve? Why are we not calling people to task on the fact that that single mom is not even being considered for the studio? So it needs to be part of the conversation. It really does. Because we're pushing up against so much. And I think we need to acknowledge, we all know there's 2 families, 6 people in a 1-bedroom. So how is it not better to put 3 of them in a 1-bedroom? Right? How is it not better to keep someone off the street to be in a studio with a brand new baby that's not moving anywhere and not needing its own room at that point? Right? Right? My mother says she put me in a drawer. Not the point, but creativity is the solution.
So it is 3:15 now. I see there's still people that had their hands up, but I'm going to end it there. And I'll just say that I hope you all enjoyed this interactive exercise today. PATH is not a perfect solution, as we saw here today, and it does operate within imperfect systems. And hopefully the data that we learn from PATH can come back and help us when we're sitting around those funding tables with funders and say, this is the type of housing we need. These are the types of changes we need in our system, instead of focusing on what's wrong with the people that are experiencing homelessness, what's wrong with the system. Thanks so much.
Oh, you want to speak? Yeah.